Dr. Geo Espinosa.
Yes.
Thank you so much for being with us today to
pleasure.
talk about men's prostate, urinary issues, prostatitis, testosterone, all those great things. But let's let people get to know you a little bit.
Okay.
So your website says, the science of living long and strong. I love that. Tell me about it.
When I really started looking at what I do, I did some significant introspection. And so, well, you know, I do a lot of prostate, but what is it that I'm really trying to do? Well, I'm trying to get my patients to live longer and stronger, not just live longer. In other words, even as they age, how can they be stronger, not decline, but improve their strength, both mental strength and physical strength. And that's exactly what I've been experiencing. So that's when I decided to just put that as my subtitle of my website. And so that was how that was formed. And that's really the mission, my mission as a practitioner and as someone with a voice in the internet world is, you know, how can that happen? And yeah, you know, I know, you know, the prostate brings you in, but then we start moving outside of the prostate and looking at the whole person. So
well, and I think it's interesting because, you know, when you and I were talking before you came in today, that there's a lot in your treatment protocols that is not have a symptom, give a pill. That it
Right.
really is. There's a lot of lifestyle and strength building activities that you
Right.
encourage in your patients
Yeah.
to overcome these issues.
Right.
That there's so much rooted in their lifestyles.
correct.
Yeah.
I vehemently believe that how one lives their life has a huge impact on how they live as they get older in terms of just health and cognition. You know, those are the things that we care about most. We want to keep our memory, and we don't want to decline. We don't want to hunch. We don't want to be what's called kyphotic, that hunch where you just break down. We want to be, and so I see. So then also I have to say, my patients teach me. They teach me what's possible. I tell them what to do. Number one, they don't have to follow follow my advice. And number two is when they follow it, I'm like, wow, this is really work. Sometimes I'm in shock. So it really does work. And thus this is really my mission. My life's mission is to, particularly with men, and many people ask, why men? Why you focus on men? Well, we're in bad shape as a gender. We die sooner, we get more aggressive cancers, we die younger than women, and our health declines sooner than women, all things considered. There's only one condition that women has that's life-threatening that women has more than men. Out of everything, heart disease, cancer, everything, prostate. No woman will ever die from prostate cancer, by the way.
Although men can die from breast cancer.
Exactly,
Right.
that's right. Alzheimer's. So women get more Alzheimer's than men, but men are closely behind. So and there's many reasons for that. But the bottom line is this: how can we reverse that?
Right.
So this whole anti-aging movement, which is not really a term that I prefer. I prefer graceful aging because we're all going to age. You're going to age, but you don't have to get old. Is what the concept is. So that's kind of
As the numbers go up, I try to focus on how I feel and not the numbers.
Right. Correct.
As much, right? Because that's a little painful.
How I feel and what do I need to do to feel, better tomorrow.
So just curious, you have, I'll call it two main practice areas. You have people come into you with prostate issues and people come into you with erectile dysfunction issues.
Right.
What's the split?
Right now, well, it depends on what I write about.
Right.
So if I
Now, I guess I'm just curious in terms of what's ailing men, right?
Right.
And what's their challenge?
So prostate cancer is a big one.
Yeah.
I would say that's probably 65% of my patient population. Then is other benign prostate issues. That's another 20%. And then another 15 to 20% is erections or erection issues or low testosterone is another segment of that.
Well, and again, we're going to talk later that it's shocking to me how many young men are coming in erectile dysfunction issues, and also you said with aggressive forms of prostate cancer.
Yeah, it's even shocking to me. The more I see these kinds of things, the more I see my patients coming. I'm trying to figure out what's going on, and certainly not. It wasn't our experience growing up in our 20s with not only me but our friends. We didn't have those issues. We talked about it liberally at the time, and we didn't have those issues. So there's reasons for that, which we'll cover.
So I think I know the answer to this, but I'm going to ask you this question, and then we'll move along. What is it that men don't realize about their manhood, about their prostate health, about their penile health, that they really need to get at the root?
Well, the first thing is that if they don't have any erection for more than 3 months, whether it's to have intercourse or morning erection or spontaneous erection, no erection at all within 3 months, that should be a red flag in their head that something is happening. We spoke about how the penis is a barometer to men's health.
I think that's a great line.
Yeah. And it's true.
Right.
And it's something that we actually have that women don't have, where we can assess how well we're doing. So that's something that they should pay attention to. From a prostate perspective is, ejaculating. It's very important. They need to ejaculate for just general prostate health, whether it's related to prostate, prostatitis, enlargement of the prostate, or certainly prostate cancer as well. Ejaculating is a healthy thing to do, and it kind of keeps the pipes clean, if you will.
Use it or lose it.
That's right.
All right, let's go do some videos. Thanks, Dr. Geo.
Okay, thank you.
If you liked what you just saw, we have a whole lot more with Dr. Geo Espinosa at our website, bottomlineinc.com. And do me a favor, share this, tell your friends. We have so much great information. Come to bottomlineinc.com.